Thank you for joining us. I am Colette Chichester, Vice President of Government Affairs here at Care First, and we're delighted to have you guys join us this morning for this timely and important conversation around securing consumer health data, balancing privacy, access, and innovation. And I think we can all agree that the rise in cybersecurity incidents and data breaches across the healthcare ecosystem in recent years has been unprecedented. Having just witnessed the worst year on record in healthcare record breaches that have left millions of Americans, millions of our neighbors with their most sensitive information vulnerable, I think this is a timely conversation to be had. As technology continues to reshape healthcare, ensuring that consumer health data is protected and easily accessible to the individual, it's a challenge that impacts patients, providers, and companies alike. And so now more than ever, it's important that we address how those healthcare stakeholders balance innovation, privacy, and access. And so today, Care First is delighted to be able to bring together some fantastic panelists, thought leaders, to dive into this pressing issue. Whether you're a policy expert or you're just looking to enhance your knowledge about healthcare-related information, its safeguards, keeping that information away from bad actors, we hope that you'll benefit from today's discussion. And with that, I'd like to introduce our moderator for today, our Vice President and Chief Information Security Officer here at Care First, Rob Suarez. Rob?
Hey, Colette, thank you so much. I'm really honored to be leading this conversation today. Consumers today have unprecedented access to their healthcare technology through electronic healthcare records, through wearable devices, through mobile health apps. In fact, nearly 80% of Americans use an online platform or portal to access their medical records. Interactions with the healthcare systems and the use of emerging technologies generate vast amounts of data that reflect our personal health. And this is leading to a meaningful benefit and value to patients every day, like the early detection of certain cancers, like more accurate estimations of the risk of developing conditions such as dementia or heart disease. And while there are many benefits to digital health becoming more integrated into everyday life, there are concerns over the data security and privacy. With data breaches growing in frequency and severity, over 86% of Americans worry about their safety when it comes to personal health information online. And this raises a critical question for healthcare stakeholders. How can we protect sensitive health data while ensuring consumers can seamlessly access their information to make informed healthcare decisions? And so in healthcare, privacy and cybersecurity go beyond just simply safeguarding systems. It involves people and protecting their most sensitive information, their health and their well-being. At Care First, ensuring the confidentiality, integrity, availability of our systems is an integral part to maintaining the trust and delivering on our mission as a healthcare company. And when it comes to healthcare, we can all agree that protecting a patient's records should be a top priority for providers, payers, and third parties alike. So with that, our panelists are leading experts in privacy, cybersecurity, and interoperability. We're very lucky to have them with us today to share their insights. I'll let our three esteemed panelists introduce themselves. And we'll start off with Samantha Birch, who is a Vice President of Technology Public Policy at AHIP. Hey, Sam.
Hey, Rob. Thank you so much. It's great to be here. Really appreciate the continued partnership with Care First. I'll avoid the boilerplate of who AHIP is because I think probably well known to this group. But in terms of my portfolio, I really sit and cover the waterfront of health IT policy issues. So interoperability, privacy, cybersecurity, and emerging technology. And while this is my second year at AHIP, and I'm relatively new to the payer side, I spent many, many years in health IT on the provider side, and covering the same sort of suite of issues and sort of watching how this has changed and evolved over time. But I've worked for the Federation of American Hospitals, the American Hospital Association. I was at HIMSS for several years, and most recently at an EHR organization called OCHIN that deploys electronic health record technology to the underserved. So again, great to be here and very appreciative for the great partnership with CareFirst.
Thank you, Sam. We're looking forward to hearing from you here. And next we have Lisa Gallagher. Lisa is a National Cyber Advisor at the College of Healthcare Information Management Executives, that is CHIME. Hi, Lisa.
Hi, Rob. Nice to be here. Thank you very much for having me. Yes, I'm Lisa Gallagher, and I am National Cybersecurity Advisor for CHIME. So CHIME works primarily on the provider side, and my role is to help our members, primarily CIOs and Chief Information Security Officers, deal with cybersecurity issues. So we do a lot of education and we do convening. So we have a cybersecurity community, and that's really meant to help people share information on the current threats that they're seeing, what are solutions that might work to deal with those threats, and basically share information to help advance the cause of cybersecurity. My background, I'm an electrical engineer and systems engineer by background. I've been doing cybersecurity work for over 35 years. I did also work at HIMSS, which is how I know Sam and Tina as well. Worked there for 10 years, doing a similar role. Went to become a partner in the PwC cyber practice, where I worked across multiple sectors, healthcare included, but also 4 or 5 other sectors, doing direct consulting with clients on cybersecurity issues. And I joined CHIME about a year ago to sort of help facilitate our members dealing with cybersecurity issues. So thank you for having me, Rob.
Hey, thank you, Lisa, for the service you provide to my colleagues in healthcare and cybersecurity. And last but not least, we have Tina Grand. Tina is president and CEO of Healthcare Trust Institute. Hi, Tina.
Hi, Rob. Thanks for having me. And hello to my fellow panelists who I hold in such high regard. My name is Tina Grandy, and I'm president and CEO of the Healthcare Trust Institute. And the Healthcare Trust Institute is an organization that's comprised of healthcare companies across all the different subsectors of the industry, as well as trade associations in healthcare and tech companies who operate primarily in healthcare. So we've got hospitals, we've got health plans, we have medical device, we have data analytics in the life sciences, we have health tech companies, and we have great trade associations like the Federation, who Sam mentioned, the AHA, ACRO, and others. And all we do all day long, 24/7, is health data policy issues. So we go deep on health data privacy. We focus on cybersecurity, AI in healthcare, and data interoperability in healthcare. And I would say the overarching mission of all of our organizations, which we operate on a consensus basis, is that we need to enact a federal privacy law in healthcare for the nation. So we work, that's our top line issue. We work on lots of sub issues, but that's the top line issue that our organizations coalesce around. And my background, I've been working in healthcare privacy and security issues for over 20 years now. I have worked with multiple sectors of the healthcare industry, and way back when in the Bay Area, I was an entrepreneur in the health tech field. I had my own company, and I have a very strong appreciation for tech startup companies and everything that goes into trying to be successful in that field. It is really neat and fun and hard. So I will stop there. Just say I'm pleased to be here today and looking forward to our discussion.
Well, Tina, Lisa, Sam, this is an incredible panel, so no pressure. But with that, we'll start the questions. And so nearly 170 million people in the United States had their health data compromised in 2024. According to data security incident reports made to the U.S. Department of Health and Human Services. Lisa, I'll start with you. How has the cybersecurity threat landscape evolved for healthcare organizations over the past few years? Are there particular trends or vulnerabilities that concern you the most today?
Yes, so the cybersecurity threat landscape has gotten infinitely more complex, more dynamic in the last few years. You know, I tell people that I used to talk about what might happen, and now I talk about what's happening almost every day. Threats are coming in various different forms. So you often hear about ransomware attacks, but we also have vulnerability with the third-party businesses that we work with and those in our supply chain. If their cybersecurity isn't good, that puts us at risk. We have newer threats, what I call nation state or political actors. So that might be Russia or China, trying to infiltrate organizations because they're part of our critical infrastructure. So healthcare is a very important part of our critical infrastructure. We see social engineering attacks that really try to exploit employees who might not be cyber savvy. We have the same, kinds of attacks for scams and financial fraud. And a newer trend is AI-enabled attacks. So the last 5 or 10 years, there's been a lot of tools online to help, just learn how to do attacks and actually some tools for them to use. But now there are tools that actually deploy AI, and you just turn them on and they start trying to find ways to attack a network. So there's technology advancement that is advancing our threats as well. With the nation state actors, we see a phenomenon called advanced persistent threat, which means they enter the network and they sort of establish a long-term presence in the network and sort of patiently traverse the network, looking around for vulnerabilities and planning an attack for later. We think that some of the countries who are adversaries to the United States are using this tactic in our networks, and all the critical infrastructure sectors. And this is something we advise our healthcare providers to look for. Looking for advanced persistent threats and stopping them is very, very challenging. And an interesting phenomenon lately, I mentioned social engineering attacks. We've seen attacks against, for example, the help desk in a provider organization where someone asks the help desk to change a password or reset an account. And those are being successful. New identity solutions have been used, but those are being subverted as well. So if, for example, we want to identify you by a video or a picture, we've seen deep fakes used. That's using AI to create an image that is not discernible by a human. So you can tell from what I'm saying that the threats and the threat vectors, we call them, the way that they get in or are successful, are really, really advancing quickly. And it's very challenging for our organizations to find defenses and deploy them quickly and to keep up with all the threats and the most recent tactics. So it's a very, very challenging environment, Rob.
Yeah, and Lisa, I think your insight there perfectly portrays how in cybersecurity we build taller walls and enemies build taller ladders, and is just this perpetual cycle. Well, thank you, Lisa. And
Sure.
let's talk about HIPAA. HIPAA currently applies primarily to covered entities like healthcare providers, health plans, and healthcare clearinghouses, and their business associates. However, many third parties vendors, including mobile health apps, fitness trackers, and AI health platforms, fall outside of the scope, even though they collect or process vast amounts of sensitive information. So, Sam, as someone that has worked closely with providers and payers, I'd like to start with you on what should be done to better address those gaps in data security.
Yeah, Rob, thanks for raising this issue because this is somewhere where fundamentally the public policy sort of track has, I think, sort of made the cybersecurity challenge more acute, right? We are very much have had public policy in place that's been promoting use of third-party apps, and rightfully so. We want patients to be able to have tools to be able to use their data and be involved in their health. Yet at the same time, right, we don't have a data privacy or even a cybersecurity construct really within HIPAA that envisioned any of this being part of the system. So we have a relatively sort of, in many ways, antiquated framework, I think, where AHIP sort of sits on this. And I will say 10 years ago, this was not universally agreed to, right? Is that we need to think really about how the protections follow the data, and this concept of sort of the four walls of HIPAA, I think just really doesn't pass muster at this point when we look at how extensive the threats are. And obviously, you know, I very rarely look at cybersecurity in a vacuum from privacy, at least in the policy context. So I think, you know, AHIP's position, and this is my personal view as well, is that I think we have to get serious about thinking about what protections look like when the data is moving so rapidly, right, across all of these different apps. So the policy goal, right, and the consumer goal is the right one, but we then need a framework that supports it. And we need those third-party apps to be subject to something like HIPAA, right? So that there's consistency. A patient isn't thinking about, oh, my data is protected here because it's, you know, with a HIPAA covered entity, and then, you know, my data is not protected here. They're just thinking about how they can learn more about themselves and how they can be more involved in their care and how they can be more proactive, because that's what we've told them to do. So I think, you know, the policy now needs to follow the technology, would be my view.
Hey, thank you, Sam. And Tina, you know, as someone that works with healthcare organizations committed to promoting and implementing data protections that garner trust for consumers, I'd love to hear your thoughts on what Sam shared. Perhaps also, what roles do consumers, does consumer trust play in the adoption of digital health platforms? How can organizations better communicate their data protection practices to the public?
Well, I want to just say I totally agree with what Sam was saying about the current situation from a public policy standpoint, and the fact that we have some information that's protected inside the HIPAA framework and then other information that isn't, and consumers don't understand that difference, and they really shouldn't have to understand that difference. They should just trust that when it's their identifiable sensitive health information, it's not going to be used in any way that they wouldn't expect it to be used. That could be used to discriminate or anything like that. To build on what Sam was saying with this sort of lack of harmonization both inside and outside of HIPAA, what we're seeing is because there is frustration and a lack of trust that federal policymakers are going to get across the goal line in achieving a national health information privacy standard, the states now are starting to really run rampant with many both health data privacy bills that are introduced, as well as health AI bills that are introduced. And it's really one is pretty dependent on the other. So we don't ignore one or the other. We have to look at both of them at the same time. We looked at the data recently, and as of April 2025, 20 states in the United States had introduced and passed their own health information privacy laws. And each of these 20 states have done it independently. They don't have harmonized definitions. They don't have harmonized risk associated provisions in them. It is just sort of, a patchwork, a mishmash. And for any organization that's working across state lines, this is a real problem. It is not only a problem from a compliance and privacy standpoint, but it does blend into AI. How do you develop an algorithm if you have different and varying definitions and standards around privacy for the data that's being used to develop an algorithm? So long story short, from that standpoint, the members of the Healthcare Trust Institute are not only working in the states to really emphasize harmonization when and where we can. It is an uphill battle, but also tirelessly working at the federal level to get a national health information privacy law passed. I would also say that just from the consumer standpoint, picking up on what Lisa was saying about all the breaches that continue and grow, this lack of trust just continues to proliferate in society. And I would, hold up a recent case that's getting a lot of attention, and that's the 23andMe bankruptcy situation. We now have both branches of Congress launching investigations into what's happened there and how 23andMe is working to protect that very sensitive genetic information. And as this is highlighted in the media, it just engenders more distrust and I think a lot of regret probably on individuals who did give their DNA to these companies that they, of course, trusted and didn't realize that there was no privacy law associated other than GINA, which is a non-discrimination employment law. But, we are lucky, frankly, that bankruptcy is the situation with 23andMe because bankruptcy law does put in provisions around how to handle data that's held by an organization. And that does give a layer of protection that if this was not a bankruptcy situation, it could be even worse. And just to wrap up with how organizations can better communicate their data protection practices to the public, there is one effort, I think it was 2021, that was launched that I thought was really neat. It was the New York eHealth Collaborative put out it's sort of like a public service announcement for folks in a limited range, probably a limited group of people in the state of New York, but it's called Mind the App. And it was a really simple, easy way to do a step-by-step process to make sure as a consumer, you are more aware of how your health information could or could not, or should not be used in, an ethical, legal way and where there are no protections and you're kind of at risk. So personally, what I would like to see, and we've talked with NCBHS about this, the National Committee on Vital and Health Statistics at HHS, is for HHS to undertake a public service campaign, doing something similar like Mind the App, but at a nationwide level, so that more consumers are aware when they're uploading their information into a wearable device or something, that a lot of sensitive information goes. The intake services for telehealth services is another one, for example, that they are aware of the risks involved. So I'll wrap it up there.
Tina, I tell you, the way you frame this is fantastic. For the folks outside of cybersecurity, oftentimes cybersecurity seems so nebulous. It seems like such a technology issue, and in reality, healthcare and cybersecurity, the cross section of the two, I think, is one of the easiest ways for society to see that it's really about trust. And well, Tina, you also mentioned AI, artificial intelligence. And so I will go to a question here for all of our panelists. Artificial intelligence is increasingly being utilized in cybersecurity for healthcare to enhance security measures, identify new vulnerabilities, and mitigate risks in healthcare environments. How should organizations prepare for the growing use of AI in digital health, especially in terms of protecting sensitive personal data and ensuring ethical use? Oh, Lisa, you're on mute.
Okay, well, so on the technology side, I mentioned earlier how threat actors are using AI-enabled attack vectors. But I want to also here explain that on the protection side, so the cybersecurity teams that are trying to protect the data and the network, there are some AI-enabled cyber tools. So monitoring tools, detection tools that we already have deployed, those vendors are deploying AI in those technologies. So what that does is it helps the cyber folks that are trying to monitor the activity and look for anomalous activity or bad activity. They're helped by AI algorithms in sort of the detection of certain patterns. So that's a positive development. There are also tools that we use to test ourselves. So penetration testing and threat detection, endpoint monitoring, there's AI deployed in those tools now as well. So while we're fighting against AI-enabled tools, we have some AI-enabled tools in our arsenal. I think there are also AI algorithms that work outside of any organization that sort of analyze the data on past breaches and try to look for patterns there. And then what you can do from that is to put out what we call indicators of compromise. So patterns that you can look for on the network to recognize a threat sooner. So healthcare organizations are trying to leverage those tools. Now, it's quite an adoption curve, right? There's an understanding and learning, and then there's deploying the tools and understanding how to use them. And most provider organizations are doing that with the help of their vendors who've got some of it integrated into their tools. So there's hope on that front because we can do some things a little faster, and we have some AI enabled assets to use to sort of fight against those potential breaches.
And Sam, anything, and Tino, anything else you'd like to add to that? Perhaps also on the digital health side?
I think something I might add is our organizations have also encouraged the use of what they call privacy enhancing technologies when you're working with data sets. It's a way, without perhaps sufficient regulations being in place, it's a way for the market to help protect that information. And it's an area of innovation actually in the health tech market that's really exciting.
Thank you, Tina. Sam, anything else you'd like to add to that?
I think Lisa and Tina covered it. There's a lot of promise, and I really appreciate that Lisa brought up sort of the adoption or learning curve, because I think that is an issue that's, sort of general to AI. That I think what we hear is, and I think we're going to get to governance and some of the other issues later, but there's just so many considerations, right? So regardless of the use case, healthcare is sort of catching up in terms of how some of this promise can be realized in different settings.
Well, it's fantastic insight that all of you have shared here. I think in cybersecurity, if you talk to cybersecurity professionals, they will tell you, I think one of the things we can universally agree on is that cybersecurity professionals want to protect something that matters, something important. And that is why it also helps us to understand healthcare as cybersecurity professionals, not just cybersecurity. So I'm going to switch gears here on questions and ask. Patients often receive care from multiple providers across different organizations, and it creates silos for critical information like diagnosis, medications, lab results and imaging. And so my question to our panelists, what is interoperability? And what role does it play in protecting sensitive health data while ensuring consumers can seamlessly access their information to make informed healthcare decisions?
Start off, I think that that's a really interesting question, right? And again, thinking from the policy perspective, which is where I spend most of my day, I think really the goal today with interoperability is really different than it was 16, 17 years ago when I started on this journey. I think at that time, the idea of interoperability or even just basic health information exchange, right, was the idea of just being able to sort of document and move, right? Anything. And I think we learned from the early experiment of the, sort of health information exchanges and things like that early on that maybe the goal at the time of, wanting your grandma's information to move from Ohio to Florida, right, was a lot to bite off. And then I think now really what I see as sort of interoperability is far more in the consumer context, in terms of what's being thought of. And I think that that's a good shift. I think that had we started there, it may not have taken so long to sort of build some of the standards and pipes and other ways to move the data. And so I think that that is a really good change. And I think what we do have, though, is obviously, has been stated many times, with this increase in data movement, right? More seamless data, focus on application programming interfaces. We have new threat risks, right? So how that gets incorporated, I think, in every individual organization or company is, it's sort of the introduction of the promise of all of this, particularly for consumers, with the added risk. So I think that, interoperability, sort of like how we've always talked about privacy and security hand in hand, I think talking about interoperability, if you're not having a conversation about cyber as part of that, then you're probably missing a huge mark.
So Rob, on the cyber side, let me just explain how a few interoperability aspects work. So when you are able to view your own record in a portal provided by a provider, you have a secure connection into that through something that is under the provider's control. So they manage that portal. And also when the providers exchange information with each other or with the portal, we have in that area a construct of standards-based information exchange that has cyber built into it. So the transaction-based exchange of data between organizations is by and large secure. The data is encrypted, the authentication and verification takes place. You don't really hear about hacks of data in transit in those controlled types of data exchanges. When it comes to consumer apps, the things that Sam mentioned earlier, and this application programming interface, we call it APIs. We do have an interoperability rule that was promulgated by HHS, which says that a patient can connect any app they want to the provider's EHR. And those apps don't have to be vetted and don't have requirements or regulation applied to them. And that's a particular area of vulnerability that Sam was mentioning earlier, that we're all still concerned about. And since it involves the consumer, we need to educate them, as Tina said, on the vulnerabilities of that connection. So you're basically, providers are required to allow these external apps to connect to their EHR and basically set up a pipe to suck data out of it. And the application that's doing the data request, it's not transactional either. It's not can I have data? Yes, you can have data. It authenticates once, and then the data can be extracted at any time. So it's a connection that's typically not secured. Now, providers then have the onus on them to put mechanisms in place to understand what all of these different APIs are, who the vendors of them are, and how to protect them. And that's a tremendous burden for the providers. And it's really not a scheme that's going to work well. So as to Tina's point earlier about the fact that we need a framework and regulation about health data that applies to and follows the data itself. If you followed that model, you would put those under those API interfaces and those application vendors under regulation as well. And I think that's really the thing that would really protect patients the most. And I think that's the biggest both technology gap and policy gap that we have right now.
And Tina, you got a couple of call outs there, so I'd love to hear your insight on this, on interoperability as well.
I was just going to add, also, those are such great remarks. Big picture, oftentimes we've heard that with increased interoperability, as Sam had mentioned, come increased concerns in security and privacy, and they're sort of like the yin and the yang in the data policy world, and it shouldn't have to be that way. You know, you should, what would be nice is if it could all work together well, and the risks are low, the information flows smoothly, gets to where it needs to be. So, you know, to Lisa's point, it really is critical that we get a national privacy law that has, you know, teeth to it, but it's workable for business organizations and ultimately focuses on the consumer and their rights and protections.
Well,
Follows the data.
yes, and speaking of data and speaking of, well, I'm an engineer by background as well, Lisa, and we have quite a few folks in this audience who are also cybersecurity practitioners. And so I will have a question for you here. What are the best practices or technologies that you see are showing the most promise in securing health data?
Well, I don't know about promise, but I think I'll start with what is considered best practice today. So encryption, for example. You know, we do surveys and we still find that organizations sometimes don't encrypt data. I don't understand that. It's been part of the HIPAA security rule. Other frameworks, the NIST CSF framework, right? The basic practices around cyber. So data needs to be encrypted in storage and also in transit. I mean, that's best practice. That's a floor. You really have to do that. And I would say also for organizations that are currently choosing not to do that, there's an even bigger risk that if you have a breach and it's found that you didn't have what is considered a basic practice in place, that's more liability for you. That could border on negligence, and that would hurt your case in terms of enforcement by HHS and lawsuits and all the other things that come after a breach. So let's just say, you know, that's something that has to be done. We're hearing a lot these days about multi-factor authentication. And I think everyone in the audience knows what that is when you try to connect to a website or your banking app on your phone, when you have to do a second form of authentication. Also starting to become considered best practice. And the reason why it's so important is because it turns out that a lot of the attacks that we see involve compromised credentials. So a compromised account that has a username and password, right? Somehow that is compromised and used as an attack vector. So multi-factor authentication then becomes important and protects each of us. The challenge with that in healthcare is there's an assumption, you know, in other sectors, maybe multi-factor authentication everywhere you have data is an easy thing to do. But in a provider organization, it's especially challenging because there's data all over the place. I mean, we have monitoring devices. We even have refrigerators that have data on them, right? I mean, there's really a challenge in trying to get that implemented across an entire provider enterprise. You know, some organizations, integrated delivery networks, even have medical schools and things like that. You have researchers, you have data all over the place, and trying to do MFA everywhere is challenging. But I would say I do see tremendous uptake in that area, and everyone knows they need to do it. It's just especially challenging. You also hear about zero trust architecture. And so it's almost to the point where it's a buzzword, like we all need zero trust architecture. What does that mean? What it means is that we're moving away. It's a protection philosophy, right? We're moving away from an older philosophy, which is that you need to protect the endpoints and the perimeter of your network. This takes a totally different mindset, which is that there is no trust in any connection or any attempt to extract data. Every single one of those interactions needs to be authenticated and the identity verified. So that's the term zero trust. And that's even inside the network. You also layer on top of that the least privileged access philosophy, which is you only get the data that you need. And you also have a concept called privileged access management. So there may be some users that have elevated privileges, like a system administrator, and those accounts may have to have special protection or special rules applied to them. And then you have to also manage, of course, third-party access, external. The zero trust philosophy requires, because you're changing the protection philosophy across your network, it's to some extent a re-architecture, both in terms of technology and the rules that you enforce. That's I think, promising framework, and folks are on an aspirational implementation roadmap for that. But I think you see a lot of consideration of that as well. And I would say, I mentioned identity compromise earlier. So really what I'm seeing as a pattern, as a challenge, is the management of identities across the enterprise, and different ways that they're being compromised and staying caught up with those. We, to some extent, may need new tools and new help from our vendor community and new approaches. I mentioned deep fakes and things like that. So we have to leverage solutions that may involve things like biometrics and other things that we hadn't really envisioned before. So there's a lot going on. I think the cyber team has a lot to consider always, because they're fighting this daily battle in an overall war, right? So you're trying to fight off what's happening daily, and at the same time trying to migrate to new technologies, new frameworks, and new ways to deal with things, all on a very limited budget. So I think that's a kind of a summary of where we are. And Rob, I don't know if you had any questions about that or anything you want me to add, but those are some of the things that we're working on.
Lisa, I so appreciate, first of all, your insight at no cost here, by the way. And then secondly, your call out for the journey and challenge that exists for cybersecurity professionals, which is there's no such thing as 100% secure, because humans create technology and humans are fallible. And so technology will always have weaknesses and vulnerabilities. And cybersecurity professionals have to manage those risks, but also the motivations of anyone that can wake up one day and try and exploit those weaknesses in technology. I think on behalf of cybersecurity professionals, we appreciate your commentary there. And I do have a final question. I would ask our audience members to warm up the Q&A with any questions they have. We'll turn over to our audience as well right after we hear from our panelists on this final question. And that is, if you had a crystal ball, what do you see as the most important shifts in health data governance over the next 5 years? And how should healthcare leaders prepare today?
I can go first. I focus, again, on the cyber side, and I focus on something with my clients that I call cyber risk governance. So we have organizations kind of look across cyber risk and do what we call risk management. So that means identifying vulnerabilities in the current technology that's deployed and trying to mitigate those vulnerabilities, right? Fix them. And that happens sort of on the cyber team and the technology team, and they're basically managing risk on an ongoing basis. When you look at the concept of cyber risk governance, that's sort of a higher level layer on top of what people do every day to manage risk. And that involves sort of at the executive level, maybe a layer of oversight on how we manage risk holistically. And so decisions are made every day, and it's based on the threat and the vulnerabilities, but it's also based on practical implications like staffing and budget. And so a decision might be made to buy or not buy a technology. Well, what are the cyber risk implications of that decision? And so there needs to be oversight on that. So for example, if we know we need to upgrade the firewalls that we have deployed, but we think that in next year's budget, we can't afford to do that. What is the residual cyber risk if we don't do that? And what type of risk are we actually accepting? Those are governance decisions, and we need to have sort of an oversight function that could involve a committee of folks who get to be involved or weigh in on those decisions. So it's really about managing, looking at unmanaged cyber risk, so where someone might be ignoring it, or risk that is kind of being accepted on behalf of the organization at a level that may not be proper, or that may need some oversight. So investing in cyber risk governance, I think, is going to become more and more of an important cyber risk reduction strategy. And it involves all of the executives in that oversight process.
Sam, Tina, anything you'd like to add to that?
I would just echo what Lisa said. I think governance in the cyber context is so much more part of the conversation than it ever has been in the past. And I think especially, and I remember exactly the corner I was standing on in February when the cyber attack on Change Healthcare happened. And I think if that wasn't a tremendous wake-up call at the interconnectedness, right, of our sector, and how important these things are. I think from the policy perspective, my goal is always to not let bad policy prevent good governance. And, I think what we saw sort of with the OCR, HIPAA security rule update, as, Lisa was talking about philosophy, right? It's sort of, okay, we're going to tell you, you need to do every single one of these things. You need to document it every single year. We're going to drop a hammer because things are not, we know we have these issues, versus, sort of a more flexible approach that's risk-based. And so I think, again, looking at things from the policy side, I think that, it's a very bipartisan issue in terms of cyber. I think the question is going to be, what's the approach? Because I think while I don't envision that rule will be finalized in its current form, that doesn't mean that Congress isn't watching this very closely, especially in the wake of the Change cyber attack. And something will be done, whether it's OCR or it's Congress coming in and mandating it. So I think to the extent that organizations are already putting these types of governance structures in place, is going to help when that day does come, because it will come.
And I would just add, if my crystal ball is that in 5 years, life is just going to be more complicated in this area than it is simple. I think not only are states going to continue to pass their own laws in the field of privacy and AI, I think it's an uphill battle getting Congress, to pass a national law that would even things out. But then, and for the engineers on the call here, our members talk about, well, then what about quantum computing? I mean, one of our members says we're 5 years away from that coming, and then what happens to all the de-identification related efforts that have been successful to date? Are they no longer successful? And how do we plan for the future of quantum computing? My crystal ball is that we will all be employed and very busy 5 years now and beyond, because I do think the world of technology, while it's exciting with all the innovations, is also just going to continue to get more complicated.
Mm. Well said. I agree as well. We've got questions from our audience coming in through the Q&A. And so to my panelists, I'm going to now go through some of those questions. So first one from our audience: with the prevalence of social engineering attacks, for example, recent text to pay tolls or claim post office packages, from your experience, which training and awareness strategies have worked more than others in helping employees become more effective in defending against cyber threats? Well, I think we have Lisa on.
Okay, so yeah, so I had mentioned a particular type of social engineering attack, and that was the help desk attacks, right? So what you see is the threat actors, they're constantly looking for vulnerabilities in our organization. And of course, a lot of those vulnerabilities are on the human side. So we have done a lot of training with our employees in terms of spam emails and things like that in the workplace. I think then you see these threat actors targeting specific areas where there's some administrators that have control over changing passwords and things like that, and they allow our employees to do that easily, right? That's where they're finding vulnerabilities. And so we constantly have to follow what the latest attacks are and then go back and train our employees on how to handle things differently. So it does play a key role. And it's always interesting to note that while there's so much technology to enable a threat actor, right, to get onto the network, they're still trying to exploit our employees. And so that's where they see a tremendous weakness. Training is always going to be key.
Thank you, Lisa. Hey, here's another question from our audience. What role can consumers themselves play in protecting their health information?
I'm happy to answer that one. I think it's really hard, number one, for consumers to play a role in this area, particularly in the app community. The terms and services agreements are long. They're meant to be read by privacy lawyers. And the normal average individual, particularly teens, they're not going to read through all of that and understand, nor should they have to. I think what can you do? I would say, as a consumer, do your homework, like search it up, type in app names and privacy or breach or something along those lines to do a little bit of homework on whether an app is trustworthy or not. What's really unfortunate is that we're sort of left on our own out in the wilderness as consumers to try to figure out whether our information is protected or not when it comes to the app world. And, as a result, states, not to belabor, but, we're just getting more complicated patchwork out there. And then once you reside in a state where there may be a privacy law, you don't know if that law has come into effect yet or not necessarily. And, it's a morass. So I think it's just kind of do your homework, search up what you're putting on your phone, maybe ask your doctor, not that your doctor may know whether something's legit or not, or privacy protective or not. But I think also just be loud and vociferous about the fact that you want access to your information and that you should have access to your information, but you want to make sure that your information is protected. Write to your Congress people, don't be afraid to speak up.
I'll just add, I think there's a certain amount of consumer fatigue out there because of the number of notifications that they're receiving. And this is really something that we tried to look at in the context of the change. Cyber attack was really, what does that sort of breach notification look like when you're talking about states and federal and multiple sort of business units within a company, and where are the notifications coming from? And I think to some extent, and I can speak for myself as a consumer on this, right? I am so used to seeing your data has been compromised that the real sort of consequences of that, I think, are becoming somewhat nebulous to consumers. And so, you know, I do think that there's a large education piece here that's really hard to do if you're, you know, in a solo doc practice and, you know, and, you know, you're trying to get through your day and see your patient panel. But I do think that there are ways that, you know, covered entities can play somewhat of a role there, because understanding sort of what's critical and what's not critical, I think it's all getting a little bit muted just by the sheer volume.
Right. And this next question is for Lisa. And Lisa, we'll make sure you're unmuted here for this. How should small healthcare providers with limited resources approach something so expensive and complicated such as cybersecurity?
Well, you know, this is a tremendous challenge. And so this is something we're focused on at Chime. And I know a lot of folks in the sector are as well. How can we help small provider organizations? So those organizations are covered by the same laws and regulations as large organizations. And the regulations and the compliance requirements are very onerous. And at the same time, they're in the situation where they have to track these threats and vulnerabilities just like anyone else. And it's very hard for them to do that. And they don't have the resources. So, you know, the entire sector is always working both on the policy side and the technology side to get them help. I'm a firm believer that if you're going to put all of this regulation on small provider organization, there should be some form of funding in terms of maybe grants or other resources that can help them with that. And in the meantime, at Chime, what we try to do is convene everyone so that they can learn from us, from each other. So CISOs are really, Chief Information Security Officers are really already sort of inclined to communicate with each other and try to find solutions that work in a real-time basis. We try to provide a forum for that. You know, information, training, education are things that we can do. But in terms of purchasing, you know, capital purchases like technology, that's always going to be challenging. And so I think this is a very important area for us all to stay focused on. They want to comply, they want to make sure that data is safe, but it's very tough without the resources they need.
Well, we are at time now, and I just want to say thank you to our incredible panelists, Sam, Tina, Lisa, for providing valuable insights on how we can better manage the evolving cybersecurity threat landscape while also empowering consumers with access to healthcare data. I'd also like to thank each of you who registered to attend this live event today. And I hope you have a great day.